My name is Renato. Yeah, with this name, I'm the Dutch booth. Then I can explain later what it is. And I will talk a bit how generative AI in action, let's say about that. So the power of generative AI for behavior change in healthcare. I'm a medical doctor, and we are trained to be reactive, right? If you are sick, you come to me, then we take a talk. If you're not sick, maybe have a beer, right? But this needs to change. I'm a sports medicine doctor. I grew up in the sports and work with lifestyle. And that is the bridge that we need to make between healthcare and lifestyle. That's the only way for us to be early intervention, create prevention, and this intervention needs to be seamless. Well, it's super powerful. Learns from large, diverse database, can capture a lot of data, can adapt to each patient. So the generative AI enable truly individualized care. But that's a problem, right? People don't want to see their numbers. I think in this room, the majority of will. But for other people, and we are working with obesity first, this is the most beautiful invention of the day. This is a scale. So if I put a scale here and ask for some people to step on the scale, not everybody will do that. But this one do not show numbers. Ta-da, right? This is what we have been studying for the last 7 years. How one single metric can help clinicians to predict behavior and therefore improve a sustainable behavior change. Was not easy. So what we did was create a simple, actually complicated, algorithm. I'm a physiologist. I was assistant professor at Federal University of Sao Paulo, so my work was with humans. I don't know if you know their species. So humans have a natural weight fluctuation. And we realized the natural weight fluctuation actually reflect your behavior. If you change food, if you change exercise patterns, if you sleep badly, that pattern change. As we learn this pattern, we are able to create, using another concept in physiology, which is the biodynamics of the human body, we are able to forecast how the weight is going. So we know if people step on numberless scales, if they will gain, maintain, or losing weight 2 weeks in advance. This simple information helps us to create a super less stress program for obese people to monitor themselves. Because we have more data and our algorithm allow us to create a super simple, intuitive dashboard that helps health professionals, not only medical doctors, to be proactive. And therefore, they can personalize the program. When you think about the personalization of the program, one interesting point is the stage of change. So if I make a jokes with salad, I don't like salad. Maybe I need to eat salad. How is the dressing for the salad? Okay, I eat the salad. I love salad. When people come to you to try to lose weight, they are here. Maybe they are here, right? So we need to tailor the program for these people. So what we created was a predictive insight that helps professionals to create a behavior alignment. And the most fancy sentence that we'll listen today is the motivational precision, meaning the medical doctors and nutritionists can be precise on how to motivate their clients. This is made on human physiology. This is based on how the humans normally, how the body works. And we are tightening then the AI capabilities to even support the health professionals on this journey. So right now, you can go to the booth, a famous Dutch booth there. You can step there and see our AI agent helping the nutritionist to create and offer the recipes to the clients, make the grocery list, send the grocery list to the supermarket, and in Brazil, we are already delivering the food to the client. This is connection between lifestyle and healthcare. And this is what we believe can make the big changes. People say, oh, these results, it's we started, the first client was the largest company in Brazil, Petrobras. It was kind of super challenging with a team of 4. And we proved to them that adherence and retention to the weight loss program was bigger, not because of our technology, but because the professionals know how to talk with their patients. They have the data. So instead to have only presential or in-person meetings, they have video calls, they have just calls, or even messages. Oh, you're doing great. Or why you're not stepping on the monitors. So basically, I can talk more about that. I will be in the famous Dutch booth. Please, let's talk about it. Well, 3 minutes, questions. Come on, why my name is Renato and I'm living in the Netherlands? That's a good question. Or what the heck you're doing in this weather if you're from Brazil? You know what I mean? No questions like that? Okie dokie. Right? Okay. Yeah, so the algorithm itself is for humans. The generative AI need to be trained by the culture, like mainly the recipes, food, or something like that. But the range of how the nutritionist uploaded, like how many calories the patient needs to eat, what kind of proteins, what kind of restrictions, that's the same. So it's easy with the super LLM and the AI generative. We are really scaling up. We are launching the app this week. So if I start to cry, it's because after 7 years and 1.5 million euros of investments, we 4,000 people testing. So we are now moving to the market. So what we're looking for is partners, investors, people that want to learn more. Be there. Yep. Amazingly, they cannot return, or I can return. Amazing, no. Yeah, just I have 2 minutes, I can come back. This is a classic behavior science program. When people are here, which is the majority of them, they have a specific process to go. And when they are here, it's easier. So if you see our dashboard, you have 150 clients. They know that 30 or 20 are here, so they spend more time. As they implement this dashboard in their workflow, we reduce their work management time in 20–25% because they can address the people that need to be addressed. Remember that the people that are coming to the doctors are already in the looking for lose weight. So that's, I think, make life of these guys easier. And we're training them to be even more accurate on how to talk with these people. I think but the beautiful part is the AI is awesome, great, but who touched the people is still the professional. So I make jokes that in Star Trek, 3,000 years from now, they still have a doctor in the spaceship, so I still have a job. So that's my point. You know what I mean? So this is it. So it's about who care. We make them focus on the, I will start to cry, so beautiful, things really works. But basically the idea is, it's the person that touched the person. That was poetic, right? So that's, okay, no, sorry, you go ahead. Yeah, sorry.
What's your target market in the geographic?
So we are, yeah, Brazil is there, is growing a lot, obesity there. Of course, US is our graal of thing. Netherlands we see obesity growing in Europe. Middle East is also a big problem for us. That's why we make the two very cultural flat, I would say. So that's easy for us to go and move overseas. We're looking for what we call value-add resellers. So we're training them how to implement. So it's scalable business. Sorry, I promised the last one. No? Sorry, pressure, too pressure, right? Okay, okay. Thank you, guys.